Okay, hello everybody. Good evening and welcome to our class today about 6 steps to 6 figures with your functional medicine practice. My name is Tal and I'm the educational director at the American Academy of Functional Health. And with me we have Dr. Chill.
Hi everybody, welcome.
So we're broadcasting to you from the Northwest. We're here in Oregon and Dr. Chill is from California. The land of the sun, Diego.
On the sunny San Diego side.
San Diego, yes. And we're in the land of the rain, Oregon, land of the rain and the green. And so I asked Dr. Chill to join me today with this unique training on practice building because Dr. Chill have a lot of experience with building practices. So Dr. Chill have built previously 2 practices that focus on functional and integrative medicine. And then those were brick and mortar practices. And then he built later on virtual practices and programs. And so I asked Dr. Chill to join me so we can share more of our experience and help you to grow your own private consultation practice, either virtual or brick and mortar in person. We got experience with both, and we wanted to share that with you. Just a little bit about myself. I've been in healthcare field for about 20 years. I struggled the first few years of my practice to grow my practice. I studied functional medicine in 3 different schools, studied a lot of nutrition, herbal medicine, integrative medicine, made a lot of mistakes along the way, had some good wins. And thankfully, I found many of the systems that we have in the academy, both clinical and practice building, was able to take my practice from that $65,000 to $100,000 a year to $1.8 million, almost $2 million in revenue. And had a wonderful team, was able to help to transform the lives of so many patients. So I wanted to ask Dr. Chill to join me because he's got so much experience with building practices. He's a functional medicine physician he's done MBA and focused a lot on business, developed systems, he's also our lead coach. So for all of you who are watching and you're in our advanced functional medicine program, Dr. Chill is one of our mentors that works to mentor you in both the clinical and the practice building. So you can learn from the years of experience that he has.
I think the biggest thing that you said was the mistakes part, right? So I'm really excited about this discussion because we've been in this for a while now, right?
Yes.
And we've gone through kind of every single system, every single kind of funnel system that's out there, and every single kind of practice building system that's out there. And our job, and actually our goal today and tonight and ongoing here, is to really kind of allow you to learn from our mistakes, show what we did right, show what the mistakes were, and then maybe have you build your practice even faster than we did. That's the whole goal with this discussion here. So I'm really excited about that.
Yes, absolutely. And, I'm glad that you brought that up because I tried marketing companies, hired and fired probably at least 4 or 5 marketing companies. And I learned pretty quickly that there's a certain foundation for practice building. And I feel like one of the biggest mistakes that I've made was that I invested so much into learning health and sickness and integrated medicine, functional medicine. But, how much do we get really in if you go to medical school or nursing school or even functional medicine schools, like how much do you really get on a practice building, if any?
You don't get anything, right? We're working with so many practitioners right now that are like, I have never learned this, even if they've gone into business school, right? I got my MBA, and running your own practice is a whole nother beast. Or running programs within that practice is a whole nother beast, right? You have to really understand not only the functional medicine side, but the business applications, and then all of the systems that are involved with it. And then how do you make these systems more efficient? How do you streamline them, right? And then how do you automate this so you can actually spend more time with your patients instead of wearing that business hat that you have to do as well?
Exactly, exactly. So one of the things that we wanted to bring to you is not just the 6-step with a special 7-step bonus that helped me to, the 7-step is really something that helped me to significantly increase our revenue. That was something that added, simply by adding the 7th step, we were able to add probably easy like $10,000 to $50,000 a month to our revenue. And not only that, but we're going to talk about a lot about the revenue aspect, but I don't want us to forget for even a second that we're talking about helping more people, right? And this is why, when we talk about, for example, consultations and the secrets for successful consultation for a cash practice, right, is we always start with, the first thing we always do is provide value to the other person, right? That could be in a form of give them a 15 minutes free consultation. So they can get the opportunity to see, are we a good fit for each other? If it's not a good fit, then we just let them know we're not a good fit. We don't think that we can help you, or, they don't feel like we're the right person for them. That's okay. But we always try to provide value, right? That's what it's all about. It's really helping patients who struggle, who have jumped around from one provider to the other, keep looking for answers. So we're going to talk a lot about revenue today, but as a disclaimer, I really want us to remember that revenue comes from providing value to patients, right? So we'll talk a little bit more about what does that look like. One thing that I'm really glad we have an opportunity to be here together, all of us, is that this is a live class. And it's a live class. We do that. We don't charge any extra for that. We do those live classes because if we can help you to learn even just 1 or 2 small, tiny strategies that can now help accelerate your success, we have done, I feel like I'm going to sleep better tonight. Like I feel like I'm going to be much more satisfied, because that's really what we're here for. On your side, for you to get the most out of this, I would recommend 2 things. One is get a pen and paper handy so you can take notes, because I got my whiteboard here and I'm going to fill this all up. I'm probably going to fill 2 or 3 pages at least today with information from both myself and Dr. Chill. We're just going to do and download of all our information onto the whiteboard. So take notes. Right, take advantage of it. You have right now in front of you 2 people who have tried everything, made mistakes, figure out what works, paid a lot of money for systems, right? I had 5 or 6 years when I had a mentor, and I paid probably between $12,000 to $20,000 for a mentor every year. Even now, I still have a mentor. I pay my mentor right now about $40,000 a year, right? So just to tell me what is the one thing, like the one strategy that I need to get to the next level, right? So,
but it's that one strategy that does everything, right? It's that 1%, that extra little bit that takes you over to the edge. And that's what practitioners really need, is that. And if you're constantly doing that 1% every week, every month, just think about all of the growth and the expansion that you're going to have within that. And this is what these talks are about every week.
Exactly. So the first thing is take notes. The second thing is taking notes is not just for you to write down the information so you can read it later or have the steps that we're going to talk about. But taking notes is also a way to trigger thought, right? It might trigger questions. It might trigger thoughts about, oh, I can do it like that, or I can do it like in my city. I may be able to do that, or maybe I want to work with veterans, or maybe I want to work with female hormonal imbalance. Like, we want you to start thinking about every step we talk about. It could trigger something, so write it down. Then, of course, the second reason is write it down and ask questions. Like, we're here. You have an opportunity here to talk to both of us at the same time. Like, you can get my perspective and Dr. Chill perspective, ask questions. We have the chat open. Take advantage of this. And this is not going to be recorded. It's live. So we got the time now together, and we want to make all of us feel free and comfortable to ask questions, whatever it is, right? So I'm very excited about it. It's a great opportunity for all of you to really learn how to do this. Now, I wanted to share, we did a survey before this class to figure out a little bit more what are you interested in, so we can better utilize our time together and serve you better. There are, I think, majority of you here are nurses, nurse practitioner, and physicians. That's what we saw from the survey. And then in terms of where you are in your practice, we're going to talk about different stages, but we're going to talk about the foundation of, like, how do we put this together in 6 simple steps, plus the bonus step, number 7. And then we're also going to talk about some advanced strategies of, like, how do you get more clients and all of that stuff without spending $1 on marketing, right? So if there's something that you're hearing and you're like, oh, I really like this, or that really resonates with me, it feels like the right thing for me, or I got a question about, like, what did you just said something, and like, how do I do that? Ask us, because if you don't ask, we don't know what it is that you are more interested in, right? So we want to keep it more specific to you. So let's take a look at what most of you have asked for in the survey. So we asked you, what are the biggest challenge in building and growing a practice? So majority of you said pricing and packaging services. So we can definitely talk about pricing. I saw that, and I prepared a slide for you. So there's a slide specifically on what are the different terms in options with pricing for your sessions, your functional medicine sessions. And after that is getting up systems. So how do I set up my systems, my scheduling? Like, how do I set that up? Marketing is also a big one. Like, how do I get more visibility, right, in the marketplace? Remember, there's a survey that showed that there's a survey that was done, and they asked patients, how many chronic patients, like, how many of you are dissatisfied with the primary care, right? And the answer was close to 70% of chronic patients are dissatisfied with the current healthcare system. So it's a lot of people, right? So we definitely want to be visible. We want patients, when they struggle, to see us. We want to be in front of them. That is something that you have to have for your practice. You don't want to be the best kept secret in town, right? You want to help as many people as you can. And then there's functional medicine knowledge. So we'll talk a little bit about where, if you're thinking about getting certified, if you're thinking about what's the process, and what else would I learn and how would I use that? What's the clinical application? I'd be happy to answer those questions. And then, of course, there are attracting new patients we'll talk about. Let's take a look at the other question. Another question that we got asked, which is, where are you in your functional medicine journey? So some of you are just starting to explore functional medicine. Some of you said, I'm already growing my own practice. Some of you are saying, I'm currently training and getting certified. And some of you are saying, I already have a practice, but I'm looking to add this as an additional service. So we're definitely going to talk about that as well. How do you add that to additional service? If I forget, please remind me. You got the chat open, put it in the chat and tell me, Tal, I already have a primary care practice, or I have a private consultation. How do I add functional medicine, right? So that's awesome.
It's really interesting, these ratios, because when I'm doing my the business coaching with the practitioners, we're working with practitioners from every single aspect of their business, right? Those that are just starting out, those that have a practice, those that want to add into that practice, and that percentage is actually really accurate. And what we try to do within the program is really kind of personalize it to where they're at within their business, right? If they're in the beginning, we have to talk about foundation with them, right? And we're going to be going through that today. And then if they already have a practice, they want to add into that, how do we look at making their systems that they have, right? Like taking a look at that, making it more efficient so they can scale that, right? Or even add in other programs. And that's what we're really going to be looking at with these business talks as well. And then what the main thing that I typically will tell practitioners is that there are three parts. There's three main parts to running a health business, right? And this is what practitioners kind of need to understand. The first part is really the marketing and advertising. That's one whole aspect of the business. The second aspect of the business is going to be the operations and then the business systems, right? The billing, the like what you're going to charge. Do you increase the prices? How do you analyze all of that? That all has to deal with operations of the business. That's aspect 2. Aspect 3 is how are you going to run the medical side, right? This is where your EHR, EMR systems come into play. So those are the 3 big aspects of running a health business. And when you take a look at that from an umbrella approach, it kind of helps to narrow down which aspects you need to focus on at which time. So I tend to go through that with all of the practitioners within the business coaching sessions.
Yes, absolutely. And I'm seeing in the live calls, there's we got practitioners from California to Florida and New York, so that's awesome. Hello to all of you, and it's awesome that you are here learning how to grow your practice. So, and also from Alaska, which is cool. So hello to everybody who are here. That's just such an awesome to spend some time with you and talk about practice building. So as Dr. Chill was mentioning, we can separate, there's different ways obviously to look at it, but we look at 3 aspects of your practice to be successful. You really need the operation side. So that's how to set up your we call it a new patient flow. There's a whole system. It's a system that was developed for the operations. And it's more of like how you automate once you automate it, it's way easier. Then you have the people in the medical side, which is like, how do you provide the services? And then you have the marketing and sales, right? Marketing is not sales. Sales is not marketing. They're both different things. When we dive into the more advanced classes, we kind of zoom in more into the marketing aspect. And the marketing aspect also going to be different if you are depending on, like Dr. Chill said, the personalization. So if you have a practice and you're doing primary care as a physician or nurse practitioner, you want to add functional medicine, there's like simple 1 or 2 strategies. There's a system called patient activation system, which is automated, and it automatically schedule patients to your schedule to the functional medicine schedule. If you don't have a practice, we might take a different strategy because you don't have the database of people that know, like, and trust you. So we might take a different approach and say, okay, you know what? Now we need to go out to patients and create that interest and present ourselves as an authority. So they will say, I want to work with you, right? That's really a big part of what it is that. So that's what Dr. Chill says. We're every time we teach you a system, personalizing the system is what really gets you the maximum impact from that system, right? Because each one of you are going to be in a slightly different stage. Jacob, did we show survey number 3?
I don't think so.
Okay, let's show survey number 3 real quick. So what would you like to learn most about building a successful practice? So most of you said how to set up my own practice, and then second to that, how to create services, packages, and pricing. And then after that, it was how to offer services effectively. Okay, great. So we'll talk about it, and of course how to integrate functional medicine into primary care, which is really, really great question. So we'll obviously talk about that. So functional medicine into primary care. Okay, awesome. So So the first question that a lot of people ask us is, how much should I charge? So before we go into the 6 or 7 steps, let's just get that first, so you have an understanding of what it is that we're talking about here. I'll start by sharing a little bit about, we work with, I would say 90% of our community members are from the US, all across the United States. We got the other 10% are from Canada and other places around the world, Europe and Asia and other places, South America. So I'm not going to talk about the international countries, because that's a whole different thing. I'm just gonna talk about the U.S. Here, what's happening here in the U.S. If somebody here is from Canada, then just let me know. We can talk about it, but it's going to be somewhat similar to what it is in the United States. So in the United States, when we surveyed last year our graduates, including nurse practitioners, and physicians, that's also include registered nurses, not just primary care practitioners, but also registered nurses that are offering functional health coaching. The range, we asked them, how much do you charge, right? And of course, they get coaching from us. They learn the business strategies. They learn how to market themselves and all of that stuff. But we're like, how much do you earn per session? The range was between $200 per session to $850 per session. That was about the range that they charge per one appointment, right? Now, which correlates to the average around across the United States, which Rupa Health did this survey, and they found that the average across the United States is around $400. So that kind of matches that the average. Now, that's just by fee per appointment. We're not talking here about programs, memberships, online group sessions. Like, we're just talking about simple one-on-one appointment. And interestingly, there's different pricing, right? Depending on so how do you know how to price, right? It depends on your presentation. It depends on your clinical skills. We want to remember that no amount of marketing can compensate for lack of clinical skills. And I've seen that firsthand here when there's a practice here, a big practice with 2 physicians and a nurse practitioner, and they shut down. They were here in Oregon, and they shut down. And one of the reasons they shut down, I already kind of had a feeling that they might not be around for a long time, and that was really sad. Not because they're competitive to my practice, but because there's a lot of people that need help, right? And I would see patients coming back with folders full of like printed pages of functional medicine labs, specialty labs. And I knew these patients paid hundreds, if not thousands of dollars for those labs. And they just didn't know what to do with them. Like, they would prescribe the medication. They would be like, oh, try this supplement or try that. It wasn't like, there wasn't like an evidence-based approach. And so the patients were dissatisfied because they spent a lot of money on stuff like that and it didn't work. But they came to see us, right? So I would ask them, where do you go to? Who got you all these labs? And they would say, oh, it's that practice. And I'll be like, oh, okay. So obviously we can't help everybody, right? We can't help everybody. But the idea is that you really want to have strong clinical skills, right? On top of strong clinical skills, you're now building the clinical application. Now you're building your presentation, your marketing, right? When people think about you, what's the first thing that comes to their mind, right? That's marketing. Like, when people are experiencing neck pain, you're the person they see first, or they think about first, right? Or when people have menopause, hormonal imbalance, like, they're thinking about you, right? Oh, I already tried that drug. I might go see Dr. So-and-so, or I might go see the nurse, whatever it is, right? Because they do things different, right? So that's a big part of your marketing. So let's take a look at this graph. We'll see how much can we actually earn. What is sort of a general potential for earning, right? So on the top, you can see, Jacob, can you put that back? So let's take a look at, this is the practice financial goals. This is where, and you want to ask yourself, where do you want to be in this graph, right? So I'm giving you this as an example because we're starting, some of you might say, we talk to a lot of practitioners every week, and we talk to dozens of practitioners every day. And some of them say, Tal, I want to make this very affordable to my community. I want to help people, and I just want to grow my own consultation practice, but I really want to help. It's all about I want to make it affordable. Okay. So you want to make it affordable? No problem. Let's say theoretically you're just charging $150, not $850, not $400. You're just charging $150. If you just have 5 patients a week, and that's our goal essentially, to help you to get to 5 patients a week, your monthly income is going to be $3,000 added income. This is 5 sessions a week, is typically one afternoon, right? So it doesn't take too much of your time, or one day, and then that will add $36,000 to your yearly income. Now, if you expand on that, use the same strategy, same marketing, same, maybe use some mentoring or coaching, you get to 10 sessions every week, then you add $6,000 to your monthly income. That's, again, about 2 days or a day and a half of seeing patients. And then if you grow that to 15, when you grow that to 20, right, 3 days of work, you'll be adding $12,000 to your monthly income, and yearly income, that will be $144,000. Now, at that point, when you build experience, when you have better reputation, when your presentation is better, you know how to present yourself, now you're starting to look more of the expert, right? So now you can bump it up. Your schedule is full, and you tell me, Tal, I don't want to work more than 3 days seeing patients. I just want to do 3 days, focus one-on-one with patient, quality time, right? Not the 7 to 10 minutes insurance appointment. I want to do quality time spent, sit with a patient for 30 minutes to an hour, understand their root causes, understand what's driving or contributing to their diseases or their symptoms. And I want to help them. I want to give them meaningful strategies they can improve their health, right? So, but I only want to do it 3 days a week. That's okay. When you charge $250 per session, that's $20,000 a month or $240,000 a year. Now, at that point, this is where you really develop your skills. You can offer functional and integrative medicine. You know it all, right? And you get great results. That's where you can increase to $450, and then you can see 10 sessions, do 10 sessions a week, and you bring in $18,000. Now, why did I add the $850 per session? Now, you might look at that chart and think to yourself, Tal, you're crazy. Nobody's going to pay $850 for a functional medicine appointment. So I wanted to, so if that's what you're thinking, I encourage you to go see some of our testimonials. For example, we got on our website testimonial by a nurse, Gina. So Gina is essentially developed. She worked with us on the clinical program, the marketing. She did some coaching with us. And then she started her practice, tiny little room, 1 day a week, right? Very small. And then she started growing her practice. And then no fancy marketing, just using the same strategy we taught her. And you can listen to her testimonials. She's 2 years out of graduating. After graduating, she's essentially charging $850 per session, and she's got 3 months waiting list. So if you get when you get to that point, if it's just a matter of if you decide to, we have the proven strategy to help you get there. But when you get there, right, you can decide, I'm only going to be in retirement mode, right? That's why the 2 days are marked in green and the 3 days are marked in black, because the 2 days marked in green is we'll call it the retirement mode, right? That's where you really just want to see patients 2 days a week, The rest of the time you can work a little bit more on your business instead of in your business, right? Which is really important. We're not going to get into that today too much. That's more of like a mastery level. But you really want to have more time to work on your business, not just in your business. And the second thing is you want to leave time for the things that you love to do. You want to take care of yourself. You want to have hobbies. You want to go to the gym. You want to go hiking. You want to enjoy time with your family. In order for us to help other people, we have to take care of ourselves. Don't forget, you have to take care of yourself, right? That's important. Your health is not less important than the health of your patients or your community, right? And when you show up healthier, more vibrant, have better relationships with your family and enjoy life better, you're going to give your patients more hope. You're going to give your patients more inspiration to show them that they can do it too, right? So if you choose to be in retirement mode, only do it 2 days, and you charge $850, you'll bring in $34,000 a monthly income and $408,000 of yearly income, right? And I'm showing you this because it's possible. And if you still think that's crazy, if you look at the pricing in my practice, we had pricing from $250 all the way to $12,000 programs, right? And you'll be surprised. Most of our patients were not wealthy people. On the contrary, we had a lot of people on Social Security. We had some single moms, people on kind of a diversity of people, right? And 80% of them were on programs, right? So people pay for what they value. So where do you want to be? What is your goal for your functional medicine practice? It's one thing to stumble into it, or I would say, I'll call it, from my experience, keep struggling towards trying to get to your goal. And it's a whole different experience when you got proven strategies and you know exactly what it is that you want to achieve. Like, you want to work 2 days, you want to work 3 days. This is the income that you want. You also want to have free time for your family or hobbies or taking care of yourself. That's okay too. You're allowed to. It's your life. Design it the way that you want to design it. We're here to help you. We're here to show you what other people are doing. Like everything you're seeing here, we got testimonials for registered nurses who are charging $200. We got testimonials for PAs, physician assistants, who are charging $250. We got testimonials of nurse practitioners and physicians who are charging $450 to $850 per hour, right? So it's okay. You can pick whatever you want, and we'll show you how to put this together. If there's any questions about this, let me know in the chat. I'm going to move on from that. I think you get the point. So I'm going to move on from that. Dr. Chill.
Yes.
I know that pricing there's different factors that go into practice, right? Into
Absolutely.
Pricing and how do you price it. But I think we all agree that, if they got strong clinical skills and they got good presentation, right, and they got good strategies, it's kind of like the recipe, right? It's the recipe for success. It's the recipe for keep increasing your services or adding more services or programs, right?
I always tell practitioners, you're your best marketer. Your clinical skills and you as a practitioner is your best marketing asset, right? Mm-hmm. Because if you're a great practitioner, I am working with practitioners right now where they're just getting referrals because they're just a great functional medicine practitioner, right? Yes. And so they're getting anywhere between 2 to 6 referrals every week just from being a great practitioner. So a lot of times, if you focus on really building your clinical skills on top of what we're teaching you in the business aspect, because you need that system in the background running for you, you will grow a successful business.
Exactly. And what you just said reminded me something really interesting, which is, we talked about the many mistakes that we've made along the way. And one of the mistakes, I remember I was working with this, there was this marketing company I was working with, and they were telling me about, we'll get you lots of leads and we'll do this and we'll do that. And the quality of the leads were so poor that most of them didn't show up. I ended up losing thousands of dollars. And then there was this thing that I heard, we all sometimes chase the gold bullet, right? And there was this marketing company who said, oh, you got to use this like this device, right? It's like this amazing device, and it's like an infra, and he does this and he does that. And I was like, wow, and I can add that as a service, and that will be amazing. So I did some research, and it was really cool device, and it was expensive. It was, I forgot, it was a 38 or around $50,000, something like that. So I was like, wow, I can add this and this and as a service by itself and all that stuff. And I purchased that device, right?
So many practitioners get lost in the magic tools, all the shiny, sparkly things.
Yep.
And we talk to a lot of practitioners that we
Yep.
try to hold them back in, be like, no, keep it
Yep.
simple.
Yep. And today, based on my learning my lesson, right? I mean, it's a big device, and it's really cool if you got laundry to hang, and if you need hooks and additional hooks to hang, it's awesome, right? But I can tell you that while we did have patients that benefited from it, it's a valid and good device. In terms of the investment, and that's what we always look at, right? In terms of when it comes to your practice, your business, your life, whatever it is, right? We always look at what is the return on investment. That's such an important concept, right? I know that it's not talked a lot about, but we always think, what's the return of our investment? If I invest this amount, what is the potential for me to make an income from it, right? And when I looked at, so this is interesting. I looked at, after I bought this device, it was like a year or two into it, and we had a few patients that came in, and so I looked at that device, and I looked at myself, and I said, well, this device is like around, I don't remember, it's like $40,000 to $50,000. And I looked at the money that I invested with a mentor. So I had a mentor at one of the points when I was growing my practice. So at one point, when I hired a mentor, it was $12,000. It was really hard for me to pay $12,000 when I first started, but I hired my mentor, and I paid him $12,000, and then there was like a monthly fee that I continuously paid him after that. And I was like, wow. I looked at that and I compared it to the device, and that device maybe have brought me $1,000 a month, or $2,000 or $3,000 additional a month. Now that's not too bad, but for $50,000, right? If you think about that. And then I looked at the mentor, the few months that I worked with the mentor, it was about a year at first. I took my practice. This mentor gave me strategies, that same strategies that we teach in the academy today. But I was at probably running between $70,000 to $100,000. And that mentor gave me 2 or 3 simple strategies. One of them was how to get more clients. The second of them, the secret of successful consultation. That completely transformed my practice. And then the third one was the follow-up, right? And I took those 3 strategies and I applied slowly over the course of a year. I took my practice from that $70,000 to $100,000. Within a year and a half or 2 years, I took it to $640,000 income, right? So if you look at that investment, the return on investment between that shiny object, the medical device, and the amount of money that I made just by learning a few strategies, I paid $12,000, but I was able to increase my revenue by over $500,000 per 1 year, right? So that's why we always tell you, good strategies and with mentorship is worth so much more than you don't need a fancy office. I always hear that. Do I need a big office? Do I need a fancy office? Should I remodel my space? And I always tell them the same. I would only invest in one thing, in yourself. Invest in yourself. Invest in your skills. That is how you develop yourself and get to the next level. It wouldn't be a special medical device or a shiny office, right?
It's
Like we're
yourself and
making
the strategies. It's
perfect.
what's going to take you over the top, right? And that's what it's all about. It's not the shiny objects. It's not the
Exactly.
machinery. It's not the office. It's you and your strategies.
Exactly. And Dr. Chill, you're a very clear example for that. After you sold your two brick and mortar practices, you opened up a virtual practice. Was doing really well, right? And it was
Absolutely.
like, and we have people in our community that are doing that virtual practice. They're charging Zerla, the PA in our community. She's charging $250 per session, right? She doesn't have an office. She works from home. You know, there's nothing fancy. You don't need anything fancy. She just has a laptop and internet. That's all you need. Now, of course, there's an evaluation tool that we give you that saves you a lot of time. It does the heavy lifting for you. There's a treatment guide with all the treatment protocols, right? So there's a lot of clinical tools we can provide you, but really you don't need anything fancy. You just need to develop the skills, learn the skills. That's all you need.
Exactly.
Right.
And we'll go over all of the systems that you'll need if you're going to run a virtual practice as well. Like, what are all of the tech that you need? What are the business systems, the operations, the CRMs, the email, the websites? We'll go over all of that as well.
Yes, absolutely. So what we're gonna show you, so I'm gonna dive into the 6 steps, and then hopefully we have some time to talk about the bonus one, the seventh step. This is really all coming from this is the foundation, and then we'll kind of branch out to a little bit more advanced stuff. Jacob, can you show the program layout? Yeah, program layout. Yeah. So this is really all coming from the what we call the Practice Accelerator program. So that's you can see the new patient flow. That's your entire operation. You have the ideal patient framework. You got the health expert framework. This is how we teach you how to present yourself online and offline. Your signature talk, we give you the signature talk so you know exactly how to exactly what to say and what it is that you do, how to explain what it is that you do in a way that makes patient look at you and say, wow, I want that. That's very valuable. And then the consultation and close is where you get commitment from patients long-term. If we are a good fit for each other, again, we always keep our integrity. If they're not a good fit for us, we refer them somewhere else. But if they are and you can help them, then we want to learn how to do the consultation and close. So let's dive into the some of our foundations and then take some questions. About I see some questions here about how can I see, do I need licenses in multiple states? We'll answer that question. That's a really good question. What if you're in New York, but you want to see patients from Texas or California or other places? Like how do you do that? What if you want to do a virtual practice and help people across the United States? There are ways to do that. We can definitely talk about that. Also, with nurse practitioners, sometimes there's restrictions, like California, for example. So some states have restrictions. So we'll talk about how can you do this? How can you use the principles of functional and nutritional medicine without obviously crossing the lines of your profession, your scope. So we'll talk about all of these different aspects. One thing that I wanted to mention is before we go into that is I'm assuming everybody here already understands the difference between functional integrative medicine and primary care, right? I'm assuming that everybody knows this. If somebody have a question about that, please ask now in the chat, because it's important to understand the difference between those. So when I talk about the 6 steps, then you have an understanding of what I'm talking about, right? So Jacob, can you bring up functional versus conventional? So I'm real quick going to show you this because I want to make sure that you do understand. If you have questions about it, there is no stupid question. Honestly, there is no stupid question. If you think about a question, there's probably 2 other people that are thinking about the same question exactly. They might be shy, they might not want to ask, but feel free to ask. So the reason I'm showing you this is not just to explain to you what's the difference between standard of care and functional medicine. The reason I'm showing you this is because if you understand this different, you understand something very, very, very important about your practice, which is, what is it that you're offering that other people don't? In other words, if I'm a patient and I struggle with chronic pain for years and I can't sleep at night and it's impacting my relationships and I feel bitter all the time and I now also develop headaches, why would I come to pay you cash $300, $400, $500 to sit with you when I can just go to my insurance and pay $50 or $80 copay at a primary care and get a prescription, right? You have to understand, why would patients pay you out of pocket for those services? Why do they pay people in our community, healthcare practitioners just like yourself? Why do they pay them? Why would they pay them out of pocket, right? So the major reason is the focus and the treatment methods. Those are really the two things that we want to focus on. So if you just understand those two things, you already got it, right? So in the standard of care, when a patient comes to see you as a primary care practitioner, you're essentially trying to do what? Listen to their symptom signs, maybe look at some of their labs, and then understand what type of label am I going to put up on them, right? Oh, your labs look like that, and you have these symptoms. You got hypothyroidism. Whatever it is, right? You got these symptoms, and your labs look like this. You got rheumatoid arthritis. So it's a label. It's essentially you focusing on what's the condition, and then how can I manage that condition with drugs or surgery, mostly pharmaceutical methods, right? So essentially it's like, here's your medication to manage your condition or symptom, and then I'll see you in 3 to 6 months, right? Why would the patients pay you? Is because they want to understand why they're sick, right? Think about the patient that, again, suffer from joint pain for years, maybe try different medications, they keep struggling. They want to know what's going on, right? If I have rheumatoid arthritis, I wasn't born with rheumatoid arthritis. What happened to my body, right? If I got type 2 diabetes, like, what happened? I wasn't born with type 2 diabetes, right? So most of the chronic conditions that your patient comes to see you with, were they born with those conditions? Most likely not, right? So our job is to look at the external and internal environment, their diet, their exposures. We look at the whole picture, look at cellular function, look at gut health, look at environmental factors, look at the whole picture and say, oh, okay, well, you have signs and symptoms of gut dysbiosis. We can test it, right? There are certain bacteria that were found to lead to endotoxemia and increase systemic inflammation. That makes sense now why you have flare-up of your joints, right? That makes sense. So we want to learn about the root causes because that makes you unique. It helps you to address the root cause or contributing factors to their diseases. Second reason why patients would come to see you and pay out of pocket is because there's a lot of patients out there that just don't like the side effects of medication. If you ever want to see how many patients are taking supplements, just Google it. How many Americans are taking supplements in the US? It's about 8 out of 10 Americans are taking supplements statistically. So think about this for a second. 8 out of 10 patients that you're seeing every day are taking supplements. They might not tell you they're taking supplements, but trust me, they are taking those supplements, right? So your patients are paying a lot of money, right? They're going to chiropractors and acupuncturists and going home and asking Dr. Google, what can I do for my diabetes type 2, my neuropathy, my headache, right? Because they're struggling. So why not offer them all the services in your clinic, right? Why not offering them a service that tells them, one, what is the root cause? That's functional medicine, right? The root cause is functional medicine. That's what it does best. And then second, which is what type of nutritional, maybe herbal, maybe lifestyle strategies they can utilize to improve their health, to optimize their health, right? That's integrative medicine, right? If you want to get good results, you can learn functional medicine and talk to your patients about their root causes. If you want to get great results, learn functional medicine and integrative medicine, because now you have the understanding of the root cause and tools, evidence-based tools to transform their health, right? That's how you get better results. And Dr. Chill, I know you've been coaching a lot of our community members on exactly this, right? How to utilize the clinical application. So
absolutely. And it's really understanding that you can utilize functional medicine with a wide range of conditions, right? And we'll kind of get into the foundation and we'll talk about should you specialize or shouldn't you? But even with a specialization, what practitioners don't understand is that within functional medicine, you're looking at their gut health, you're looking at their environmental toxicities, you're looking at their hormones, right? This is a really comprehensive care approach to everything, because we're looking at the root causes, we're looking at the contributing factors, and there's multiple contributing factors that are related to our patient's disease progression, or we're trying to decrease their risk of progression as well. So we really have to look at all of these different areas for our patients, even if you're specializing.
Yes, absolutely. So hopefully that was, now you understand the difference between functional integrative medicine and conventional approach. All are needed, right? All of them are needed. It's just that once we get the patient managed, right, with their appropriate prescription, now we can start diving deeper into the root causes. And the first thing I always tell patient is don't worry. It's not like we're gonna dive into the root causes in the next few months and just leave you hanging there in pain and suffering, right? We're gonna give you strategies today to, I'm gonna give you like evidence-based strategies. Okay, these are two methods, two ways to reduce the inflammatory pathways, right? Here are one nutritional strategy to also reduce inflammation and joint pain, right? So we always want to give them strategies like right now. That was really what made my practice different than other practices, functional medicine or primary care, because we gave them all the tools on their first or second visit. So they can already start taking care of themselves and heading towards better health, right? Because otherwise, if they just take a pill, I mean, look at what's going on with type 2 diabetes, right? It's a condition that there are medications for that condition, right? There's insulin, metformin, there's lots of different pharmaceutical solutions. But our problems is not the lack of pharmaceutical drugs. The problem is that if you look at the amount of people that develop complications, cardiovascular, neuropathy, they're now calling dementia and Alzheimer's, type 3 diabetes, right? If you look at how many people are damaged by that disease or killed, the American Diabetes Association is reporting over 240 diabetic patients die every day because of the complications. So we might think to ourselves, oh, well, we're taught in medical school, we're going to give them metformin or insulin and their blood sugar levels, hemoglobin A1C looks better 3 months later. But what is the impact 5 years into it, 10 years into it, if the patient is hospitalized with a stroke or develop neuropathy and they no longer can sleep at night, they have pain all the time, they lose their balance, right? We have to think about, as healthcare practitioners, what is the long term of what the services and the guidance that I offer my patients. And of course, there's nothing wrong with just offering functional medicine and not doing primary care. We have practitioners who do that, who decided, I'm just going to do functional medicine. That's okay too. You can do that. there's a way to do that. Have a strong disclaimer in place that you're not doing primary care, standard of care, but you can do both. You can do primary care. You can do mixture of integrative medicine. You can do, you can decide the way that it's your practice. You get to decide what you want to do. And even if you work for somebody else, when I worked for a pain center, I did what I do, and then I still would recommend them a few integrative strategies. I would tell them, oh, look at this supplement, look at this nutritional strategy, whatever we can to help the patient, right? We want to get better clinical results. So we're going to answer some of the questions as we go into the offer and entity and all of that stuff. So let's talk into, you got your pen and paper ready, and you got the chat ready for asking questions. We're gonna dive into the six steps. So this is the fundamental essentially. So I'm gonna dive into some of them a little bit more, and some of them I'm just gonna kind of breeze through. If there's something you're interested in talking about more, let me know in the chat. So the 6 steps. So the first step you always want to think about is the offer, right? Even before we get to like, what software do I use, the technical stuff, like this is the most important thing, and that is your offer. And when I say by offer, I don't mean functional medicine, right? I don't just mean functional medicine, because when we tell patients functional medicine or integrated medicine, it's, to some of them, they're still trying to understand that concept. Maybe they heard about it. We definitely get a lot more people now than 15 or 10 years ago that are actually wanting functional medicine. Like, we got people reaching out to us all the time. Where can I find functional medicine practitioner, right? But even the VA last year, the VA reached out to us and asked, can you recommend practitioners in our area for functional medicine, right? So we're getting more and more, it's getting more and more attention. But
there's still so many patients that don't understand functional medicine, right? And so, yes, the 2 out of the 10 patients are going to understand functional medicine. That's what they're going to come to you for. But you're missing 8 out of 10 out of those patients that don't understand medicine. So how can you put an offer together that they're going to understand and that you're speaking directly to them, right? This is going to be clear in this messaging. And this is part of that strategy that we were talking about that's going to take you that 1 to 10% more.
Exactly. And I'm so glad that you brought it in, because essentially we're trying to help as many patients as we can. And we might have a small percentages of people who are like looking for you. They're like, where are you? I'm looking for a functional medicine practitioner. I tried this medication, that medication. I tried this and I tried that. I'm struggling. I read about functional medicine. I'm trying. But what about all the other people, right? They're struggling, right? And they're looking for other solution. And by the way, some of these people could be our family members. Mm-hmm. Like, this is an interesting story. I didn't really share it much, but my mother, she's getting closer to she's like in her late 70s. And I always try to keep everything I learn, I apply for myself, my family. I want to keep everybody healthy and vibrant. And my mom calls me and she's like telling me about these symptoms. And she's telling me, Tal, I've been getting this muscle pain and aches, and my tongue is a little numb, and I feel this fatigue. And I'm like, wow, I'm like trying to understand. Well, walk me through, like, what's happening? What's going on? Like, what happened? What are you doing? What did you change? And she tells me that she went to her practitioner, a primary care practitioner. And she's a really good primary care practitioner. She knows my mom for years. And my mom's cholesterol was high. And I don't remember how high it was, but it was higher. And she kind of spooked my mom into like, you got to take statins, right? She put her on statins. So my mom comes back, takes her statin medication, and she started experiencing all these side effects, right? She's starting to get some nausea, starting to get some muscle ache, starting to get fatigue, right? And we know when we learn functional and integrated medicine or nutritional medicine, we know statins induce deficiency of CoQ10 with so many patients, right? And CoQ10 is really essential for muscle contraction, your heart health, right? So immediately what I told my mom is like, listen, I mean, you should take some CoQ10 if you're taking statins, but we can high cholesterol is not like we can help you with that. That's not a massive challenge. We can help you with that. There's some really good, like, if I can give you 2 or 3 strategies and your cholesterol will go down, right? So just go back. My mom was like, I got to talk to my doctor about it. I was like, great, go talk to your doctor. She comes back. I asked her, how's it going? And she's like, oh, so I think I might, she was telling me that I need to take statins. And I was like, well, would you tell her about all the side effects? And we want to try it in a natural way for, like 2 or 3 months. And she's like, yeah. I was like, so what did she do? And she's like, well, she prescribed me ibuprofen for the muscle ache and nausea medication for the nausea, right? So now my mom went from taking no medication, being healthy in her 70s, to being on 3 different medication. So I'm sharing this story with you because how many of you here, answer honestly, nobody's around, nobody's listening, answer honestly, it's just you and yourself, right? I mean, we're here, but we can't hear your thoughts, right? Answer honestly. How many times have you seen a patient starting on 1, 2, or 3 medications, and then 10 years later, they're on 10 medication, 15 medications, right? How many of us have seen that happen, right? So that's where a lot of patients come to see you because they're looking to help improve their health, not more and more medication with more potential side effects, right? So we want to help people like my mom who might not know what functional medicine is, even though her son has been in the field for like so many years, but she might not know. But she would definitely, my mom is a person that if she keeps struggling, she'll definitely keep looking for the person to help. And if you show up in front of my mom and you say, oh, you have high cholesterol, I can offer you with a different way to treat it. My mom will be happy to pay you money so you can give her those strategies and educate her about it, right? So this is where it comes to the offer. So the offer is not what you think, right? Not what you think it is that you're offering, which is I'm offering functional medicine, or I'm offering integrative medicine, or I'm offering both, right? Or I'm offering primary care, integrative primary care, right? Your offer, because that doesn't tell much to the 90% of patients that might be benefiting from your services. What you want to offer, your offer should focus on what the patient is looking for, right? So what are the patients looking for, right? Let's put here patient. So patients are looking for relief and better health, right? So they're looking for natural solutions to whatever it is. Natural solutions to diabetes, natural solutions to joint pain, natural solutions to whatever it is that keeps them up at night worried about their health or bothers them all day long, right? Another way to think about it is you're offering root cause solutions to, right? So that's another option, right? Root cause solution or root cause of these issues, right? You're offering integrative solution, right? But the reason I'm showing you these two is because we have actually tested for several years, which headlines get the most attention of our potential clients, patients. And we found that natural solutions is a very, very, very strong offer for patients. If you think that I just made it out, Google how much Amazon paid for whole foods. Whole foods is natural solutions, right? Organic, cleaner. It's got, all these health benefits, right? And and I can save you some time, but you can Google it. Amazon paid $7 billion to Whole Foods because they offer this. They offer natural solution, right? They offer health.
And you can look up keywords that are highly looked up, and natural solutions is one of the top key choices that come up. You can even just look up Google keywords, right? Top choices, and natural solutions is one of the top choices that come up. So these are ways that people are going to find you, right? Key terms like natural solutions to bop, 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 right? And you want to focus on pain points. What are these patients going through, right? You're talking to somebody, and when you just say functional medicine, you're not really talking to somebody. You're not painting a picture of what's going on with them, right? But when you're saying natural solutions to your joint health, natural solutions to better sleep, you're talking to a specific type of patients. And this is where your messaging can get really clear for them, because this is where practitioners will often make a mistake, is in their messaging. And they often ask, why are patients not coming to me, right? Because their messaging isn't clear. And when you put in something like natural solutions to bop, 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 or root cause medicine approaches to pop, 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 it's going to allow you to make your messaging more clear to them.
Absolutely. So a few of the things that I would recommend looking into is natural solutions to whatever it is. Another one that is really good is I'll post it here, is we treat, or how to treat, whatever condition it is, right? Without more drugs, right? And you can say, if you don't want to say treat, you can say we help patients with this without more drugs, right? That's another way to utilize your offer. This essentially is your offer. So where do we use our offer? Our offer, your core offer, can be used anywhere, right? So let's say I focus on helping patients with type 2 diabetes and neuropathy, right? You can build a whole practice just on that. When I meet a potential client, that could be in a party with friends, in a lecture somewhere, wherever it is, right? And somebody asks me like, so Tal, what do you do? I don't say I do functional medicine, because then it gets myself into a whole conversation of explaining what's the root cause and this and all of that. And I can do that with you guys because you're healthcare practitioners. When I tell you that gut dysbiosis or changes in the gut microbiota can cause endotoxemia, it can cause activate inflammatory pathways and interleukin-6 and cause systemic inflammation. You understand that, but our patients don't. So it's not what you think it is that you're offering, it's what your patient understands, right? And what is the benefit for them? Because essentially the patient will only pay because of one thing, because they want the benefit. So natural solution too. So somebody asks me, Tal, what do you do? I'm like, I offer natural solutions to type 2 diabetes in an integrative approach, right? And then they ask me, well, how do you do that? Well, I use integrative medicine instead of more drugs. I also look at the root cause of type 2 diabetes, and I can educate patients about what it is that's keeping them sick, right? I can use we help or treat patients without more drugs, right? So again, very similar impact to, offering natural solutions, right? So we help patients with this, right? to get better. We help patients with type 2 diabetes to get better and reduce their neuropathy without more drugs, right? That's another way to emphasize what it is that you're looking for. The reason I'm talking about these two is because these are the strongest ones that patients react to, and that's where we want to be. So you can also use these topics when you're doing your signature talk. Signature talk is one of the 7 methods we teach when you want to get more clients but don't want to spend any money on marketing. You just want to get patients and really offer services to your community and show up as the expert. Then these really helpful, right?
And a lot of practitioners that are just starting out, because functional medicine and integrated medicine is so broad, right? They're like, I don't know which one to pick. So this is what I tell practitioners. Was there something that you dealt with personally, right? From your perspective, because then you're going to be able to relate to the patients. Or was there something that a family member went through that you helped with functional medicine? Again, you're now going to be able to relate personally to them. Or was there a patient base that you're working with that you have a really big passion for? This is, again, if your patients feel your passion with it, it comes back to you're the marketing person, right? It's going to make them refer more patients to you because they're going to feel that you really care. So for me, I worked in skin health because for myself, I dealt with chronic cystic acne for the majority of my life, right? And I used functional medicine to heal myself. And then so with my story, I was able to reach to other patients and I was able to connect with them, right? And so it's one way to look at how can I connect with, again, going back to the patient more, right? What do they need? How are you going to connect to them more? How is your messaging going to be more clear to them? And so if you don't know where to start with yourself, your like something you went through, a family member that's going through something, or patients that you've worked with that you have that you have a specific condition that you have passions for.
Absolutely, and I'll add a personal example from that is when I lost my grandma, who was sort of like a second mom to me. She raised me when I was younger, and I saw her going from speaking 5 different languages, very smart, very social person. Within probably 2 to 6 years of the symptoms starting, she was forgetting things, and then 2 to 6 years into it, she was just really a shell of a human. She could not recognize her family member. She could not take care of herself. It was very sad. We took care of her at home as much as we could, and then she was in memory care where my father and I would drive every day to feed her, even though we were paying thousands of dollars for memory care for nurses and staff to take care of her. But my father would go in the afternoon to feed her lunch. I would go in the evening to feed her lunch, and she passed away. And it left such a big hole in my heart that I decided that I'm going to develop a health program for older patients with initial stages of dementia, memory, cognitive deficiencies, and or people that are concerned about Alzheimer's. And I can tell you that I developed that program using the functional medicine, integrated medicine strategies, and we had phenomenal. We still have video testimonials of people who are diagnosed. They started having the symptoms, and within 6 to 9 months, we got 100% reversal of their symptoms. Of course, it was a big blessing, and our big success was very limited to only the initial stages, patients with the really initial stages. But then my big win is also I had my father. As we know, Alzheimer has a very strong genetic component. So my father started developing these symptoms it was like 8 or 9 years ago. And I told him, Dad, you got to come over here. And he stayed with us for a few months. He did the program. We did some testing to figure out what could be inducing that neuroinflammation. And we took about, I would say, 4 to 6 months. We got 100% of reversal of his symptoms. That was 7 or 8 years ago, right? And he's doing great. He's like in his 80s now, and he's doing amazing, right? He's traveling. He's going to Spain now to visit my brother. So it's it's really what it is that you're passionate about. That's what Dr. Chill was saying. Like, is there something, a patient that touched you, and it was like this thing, right? And it really leads me to another big tip. I'll give you a pro tip. This is a pro tip from me and Dr. Chill. We're actually talking about this before we went live, on how much it's so important to have a niche instead of being a generalist. I'm just doing everything, right? Having a niche is so important, because if you think about it, there's a reason why people pay more to a specialist, right? Think about it, not just in medicine, but also in let's take construction or home improvement, right? In Oregon, we can pay a handyman is somebody that knows everything. And I got a guy that I've worked with for several years, and he helps us. He comes over and he knows a little bit of plumbing and a little bit of this and a little bit of this, and it's very helpful, right? But if I call a plumber or an electrician, they're not going to show up for less than $150, right? It's because that's what they do. That's all they do. They specialize in this one thing: plumbing or electricity. Anything else, don't talk to me about, right? So it's okay. Like, you can pick a niche, and it's better if you pick a niche. And you're gonna ask Dr. Chill. Dr. Chill, you picked a niche when you went virtual.
Skin
right?
health.
And yeah,
absolutely. And it did really well because I was that person. And that was my brick and mortar that after I sold it, I transitioned into an online practice because it did really well, because it was a niche, right? People wanted natural solutions to skin health. They didn't want to be on the medications, the all of the things that their dermatologists were putting them on, and they weren't getting better. Their acne was coming back, their eczema or psoriasis was coming back. And so when you're offering comprehensive care and natural solutions to a specific situation or a specific condition, people will find you.
Exactly. And I rather go, think about it as a patient. If you're struggling with chronic back pain or arthritis or neuropathy, right? And you got two options. You got the generalist practitioner, or the practitioner that specializes and mostly do chronic pain, right? Functional medicine for chronic pain. Who are you going to go to, right? Of course, I'm going to go to the person that does mostly chronic pain and present themselves as the knowledgeable person for chronic pain, because they probably see a lot of my cases, right? And they probably know what to do. So that's exactly what Dr. Chill was saying. That's a big pro tip for you. You can use this formula, natural solutions, to, for example, whatever it is that you want. So when we first started, we did natural solution for chronic pain, because I used to have chronic pain. I was on 3 different medications and steroids, and I used functional medicine and integrated medicine to get off all of those and significantly improve my health. And now I'm actually physically active. I work out every day. I feel great, no pain, right? I have a lot more energy. So, that's my inspiration to help others. So I did natural solution to chronic pain, right? Later on, as years went by, a lot of patients came in and said, Tal, can you help me with type 2 diabetes and neuropathy? I was like, yeah, let's focus on that now. Let's build another service and a program just for that. Natural solutions to neuropathy and type 2 diabetes, right? So you can add more specialties, but in the first, I would recommend focus on 1 or maybe 2 that are highly on demand, right? And we can help you. We can help you pick. We can tell you, because we tried. We had programs for weight loss and thyroid and this and this. I probably tried over 20 different niches, and we can already tell you what would work better, what would work less, what would take less effort, what would be super high in demand. One of them is chronic pain. Chronic pain is very, very high in demand. So let's dive into step number 2. If you guys have any questions, hit us on the chat. So step number 2, once you figure out your niche, who are you serving? Once you figure out your messaging, your offer, right? Then we move to number 2. We're not going to spend too much time in number 2 because that's a little bit more technical, but that's what is your legal entity. So legal entity is very simple to establish. There are actually companies that's what they specialize in. They can set up your legal entity. You just pay them, they set it up. There are companies from $100 to all the way to $500 that we worked with, and they'll help you set up the legal entity without you needing to do anything. So it's pretty straightforward. What would you recommend? There's 2 options. There's S Corp, which a lot of practitioners go with, and there is LLC. LLC is limited liability corporation, right? S Corp is just you as a solopreneur, which means solopreneur means essentially it's you in your office and you're self-employed, right? That's S Corp. There's pros and cons for everything. We recommend to consult a financial advisor or an accountant, but we tried both. We can give you sort of the general outline. Essentially, S Corp has some benefits to it in terms of taxation. Mm-hmm. LLC, if you want better protection for yourself and your personal assets, then you definitely want to use LLC. LLC protects you from something happening in your practice. It creates its own entity. So LLC is its own entity. You can even have an NPI number for an LLC, right? Your practice could have its own NPI number. So it is a completely different entity separate from yourself. You can be the owner, the director. It's quite simple. You can set it up yourself or pay one of those companies, and then that provides you with the protection. Dr. Chill, you want to add anything to that?
I mean, the main points of doing a legal entity is protection and taxes, right? So what I would recommend is just to Google what is the difference between an S Corp and an LLC. And then from there, you're going to, and you can say, what is the protection differences? What are the tax differences? And then from there, it's going to give you a little bullet point of the differences between the two. And then you're going to pick which one's going to be best for you. And then from there, go to like a legal expert or a financial accountant and ask them what is going to be best for your business. And it's different within different states. Different states have different legal ramifications for an S Corp and LLC based on the practitioner that you are. So you'll also want to look within your state as well. So there's a couple of different things that you'll need to do is look at the tax advisor and the legal expert, as well as looking at your state and what you're able to do as a practitioner within that state.
Yes, absolutely. I'll give you a pro tip. Essentially, with both the advantages that you can write off anything related to business. Mm-hmm. So think about you are getting new clothes, you're doing your nails, you're doing your hair, you buying something for your practice, you're buying a new laptop, you're buying, you're essentially with the IRS, the way the IRS looks at it, as it's not you're buying, it's I'm investing in myself and my business, right? So anything related to your success of your business, it's not you're buying, it's in the eyes of the IRS when you submit the receipts and everything, it's you're investing in your business. Instead of showing up with PJ, you show up with a nice button-up shirt, you show up with nice shoes, that is with nice nails, that is a part of your presentation, right? And that is a part of the investment. Also, when I paid my mentor $12,000, right? My first mentor was $12,000. My current mentor is about $50,000, right, a year. It's all an investment. I get a deduction from the IRS, right? So I have to pay Uncle Sam less than what I would pay otherwise. And I get the benefit of the training, the guidance, whatever it is, right? So you can do that with both, but their LLC just provides you better. This is from my conversation with multiple advisors and legal consultants. LLC provides better protection. And then Sabrina mentioned something that is a really good pro tip. Thank you, Sabrina, for bringing it up. That LLC can work as you can submit taxes as an S corp. So essentially, you're an employee of the business. So that saves you in earned income, right? Sabrina said, "I'm an accountant who'll be changing career. My profession has changed." Awesome, Sabrina, welcome. So, and you should, Sabrina, check out our functional nutrition training. We got accountants, we got previous police officers, we got previous lawyers, real estate agent, and it's an awesome training. So essentially, thank you, Sabrina. As Sabrina mentioned, you can file for LLC, submit as an S corp, essentially where you are now an employee of the business, right? So the business pays you, that's an expense, right? So that's that. Let's go into number 3, how to collect payment. So of course we gotta have a way for patients to pay us, right? So collecting payment is pretty straightforward. There are 2 platforms you can do that. One is Stripe. There you go, Stripe. And then the other one is PayPal. So those are pretty simple. By the way, both are free. So this doesn't cost you anything to set up a Stripe or PayPal. So once you have established your legal entity, you'll be going to the bank and setting up a way to collect payment. So that would be Stripe or PayPal. That's collecting, and then storing the money. Right? That would be essentially your bank. And so you'll be opening a business account. What I would not recommend is to mix your personal and business money together. It's easier for tax purposes. Sabrina is already Sabrina, you already attending? You're in our functional nutrition? That's awesome. Glad to have you here. And Sabrina's probably going to be able to pitch in here, but from the multiple advisors that we have consulted with, it is better to have your personal separate from your business account, because when money comes into your business, it is better if it's not mixed with your personal. Now, money comes into your business. Let's say a patient visited your practice. Let's say you had 10 patients this week, and they're going to pay you $300 each one of them. That's $3,000, right? So let's say that's $3,000 coming in to you this week, because you charge $300 and you get 10 patients, right? Every month, that would be $12,000 coming in to your account. You might pay yourself out of those $3,000. You might pay yourself, let's say, $6,000 to $8,000, right? Or whatever it is that you want to pay yourself every month, right? From that money. And so that goes from the business to your personal account as a payment, right? So that's really important to separate it, because this is its own entity, right? And you are your own entity, right? If you got any questions, let us know. I'm here, And we got Sabrina here to give us some guidance as well.
And really
So,
keep it simple. I have a lot of practitioners asking me, well, what about this payment gateway? What about this payment gateway? There's a lot, right? But when you're starting out, keep it as simple as possible. And then when you're down the road and you have more time to make things more efficient, or maybe you're trying to increase that bottom line a little bit more, then you can look at other payment gateways. But Stripe and PayPal are really easy to integrate. You don't have a lot of headache around both of them. So just keep it simple for yourself when you're just starting out. But there is a service fee when you charge. Let's say you have a patient that uses a credit card, right? And it goes through their Stripe or the PayPal. Within a business setting, there is a percentage that they take. It's anywhere between like 2.5, I think it's 2.75% now. So just be aware of that as well.
Yes, absolutely. By the way, even we always tell our community, keep it simple.
Mm-hmm.
The strategies that we are teaching in our fundamental and advanced classes is all proven strategies. And when my mentor taught me a strategy and I went in and tried to change it on my own because I wanted this something different, I messed it up, right? So use the recipe as we give you, and of course we can help you to personalize it based on your unique situation, but we know what works and what doesn't. And when I say use Stripe, it's free, right? We've used Stripe even when we had a team of physicians and nurse practitioner and a nutritionist and a health coach and acupuncturist, and even when we're getting close to $2 million in revenue a year, we still use simple. We don't overcomplicate it. Everything we teach you is simple strategies. That's the magic of this flow, right? It's simple. Let's get into ways to communicate. So step number 4, ways to communicate. Right? So this is really, really important. How do you communicate back and forth with your patient, right? So this is really important. So in order to communicate, there's different options that we're going to talk about. The simplest option is you can use Google Voice. Google Voice is, if you got a Google account, you just go to Google Voice. You just Google Voice. It's integrated into Gmail. Gmail is free, by the way. You don't need to pay anything for Gmail. And you can connect your phone number, your personal phone number to Google Voice, and Google Voice will give you a brand new number. So, and it doesn't cost you anything. So if you're just starting and you're like on a small budget, use Google Voice. Patients can leave you voice messages. If patients call, they don't see your number. They see the Google Voice number, and that call is going to your cell phone, right? So it's going into your cell phone, and it will say, call in. This is the person that's calling, and it's coming from Google Voice, right? So that's one option. Now, if you want it a little bit better, you want a system where you can actually call out. It's HIPAA compliant. Like you can do all of that. You can call, you can text. It's HIPAA compliant, and you don't have to concern about patient disclosing things on the line. We have the Practice Accelerator program that we're starting next month. That includes, you get a phone line, you get a software that allows you to communicate HIPAA compliant. So we got all of that for you, both SMS and phone communication and email, all HIPAA compliant and secure. So we got all of that for you as part of the Practice Accelerator and the 6-figure blueprint. So that's all taken care of. And if you want more information about it, reach out to us. We'll be happy to get you more information. So let's get into, so that's way to communicate. So Google Voice is free. And then you want to make sure that you pick an EMR. So EMRs, some EMRs will have a way to communicate in terms of emails. So EMRs, you can use, there's Practice Better. That's one of them. And EMR is really just a place to put your notes in. So you get a patient in front of you. You want to put your notes. That's where the EMR goes, right? So Practice Better is a good one. It is a little bit more expensive, and I found it while it's good, it takes a long time to set up, which I didn't like. So I'll give you another option that is, again, simple. How can we start right away, right? Without spending too much on tech, too much money or too much time, right? That's what I like, simple. So Clinico. So Clinico with a K. Clinico is a simple software. It's like $50 a month or something like that. It's between $40, $45 or something like that. And it's simple. You got your intake forms, which you can take from us, the functional medicine forms, and just upload it to Clinico. You can take our HIPAA compliant forms and all that stuff from us, from our program. Everything you can upload to Clinico. You can insert to Clinico. And then Clinico is where you put your notes, your appointment notes. You can put the you can have a scheduler. So scheduler for the patient to schedule, and then this is also secure, so it saves your notes in a secure manner, right? So very simple. Now, how do you do if you do virtual? I know that many of you are doing virtual. The simplest way to do that is Zoom. So Zoom, there's a HIPAA compliant, and that's about $15 a month. Right? So again, keep it simple. We tried EMRs from $50 to like $1,000 a month when we thought that, more sophisticated is better, and we were wrong. The simplest ones are great. So just when you're starting, just use the simplest one. We eventually reverted to Clinico several times. That's what we'd recommend. Okay, so that's
and the EMRs really kind of run the medical side, right? It's the part of the three aspects that I was talking about earlier. You have the marketing, advertising, you have the operations, the tech, the systems, and then you have what's running your medical health information, right? And it's that medical health that it's really important that it needs to be HIPAA compliant. And the Practice Better, Clinical, these are all the ones that functional medicine practitioners use because they're made specifically for functional and integrative medicine practitioners.
Exactly.
And oftentimes they'll have a way that you can do the Zoom meetings within those EHR systems as well.
Yes. So Practice Better, if you got Practice Better, for example, you'll still have to have Zoom because that's what Practice Better uses. So you still have to have Zoom. So I'm like, why would you spend, I don't know, $200 a month on a place to put your notes when you're first starting, when you can just pay $50, right? Mm-hmm. So just simplify it and open up a Zoom. So all in all, it's not very expensive to run a functional medicine practice. You can do it virtually just by having Clinico and Zoom. And you do need a way to communicate with patients, which I mentioned before. But that's really all you need, right? And then in terms of step 5, this is where we get into the more, I would say, beyond the tech and the fundamentals. This is where we're going into more of the important part. So unfortunately, many practitioners miss, which is your messaging. So create your message. This is number 5, right? So your message, your messaging, right? Now, your messaging we have different names for it. It really depends on what scenario it is. So if you are talking to a person one-on-one, let's say a consultation, or they're sitting in your office, or they're on the phone or on Zoom, and they're trying to figure out are you the right person for me? Are we good? Are we the right person for each other? Before they commit to working with you, for the next 3, 6 or months or a year, right? This is called the primary script. And then if you're doing it in a setup of you're doing a health education seminar, right? And you're going out and teaching in your community, which is something that a lot of people are scared to do, but I can tell you that it's one of the best things you can do to your community and impact a lot of more people at the same time. And show yourself as an authority is to actually show up where your patient needs you. And we'll talk a little bit more about that in step number 6, which is finding your clients. But that is called essentially. Jacob, can you bring up the what's it called? The program layout. So in the program layout, this is called the health. We teach this in the health expert framework in the bottom. And this is, if you do a lecture, then this is taught in your signature talk. So each week essentially, in the first 2 months, each week we focus on one of those. Like the first week, the new patient flow for your entire operations and how to set up your prices and what to do in your first session, second session, third session. And then week number 2, we go into the ideal patient framework, which we work a lot more on this, your consultation, secret to successful consultation. And then week 4, we go into this, your signature talk. So your signature talk, essentially, this is all just your messaging, which your messaging is very simple. It's really all about who you are, right? Who you help, how you help them, right? So it's who you are, who you help, how you help them, right? That's all it is. Again, we like to simplify things, right? Now, obviously, when we get into your signature talk, then me and Dr. Chill, this is like a 2 to 3 hour class just on, and we also give you the presentation, so you don't have to create anything from scratch. We give you a proven presentation that we've used. And then the primary script is, there's a specific script on how do you do the consultation. There's like steps you take to get them to essentially say, yes, I want to start working with you, either for 3 to 6 months, or maybe they're committing to a program, like let's say a 4 months diabetes program or weight loss program. But both are really important. This is just when you're talking to a group. This is when you're talking to one-on-one. Okay, so that's the difference. But let's take as an example, what is the messaging, right? So we talked, I'm going to utilize something that we talked before, right? So we previously talked about this, right? Natural solutions to diabetes and neuropathy, let's say that, or natural solution to women hormonal imbalance, right? That's a very, very much needed, right? So many women are struggling with their hormones, right? And then they go out and they're either put on hormone replacement therapy, they're put on thyroid medication, and they're still struggling. There's a lot of reasons to that, right? Because one, for example, what if it's systemic inflammation that's causing the havoc, right? What the hormones are not going to take care of that, right? What if you gave them T4 and they got symptoms of hypothyroidism, but they are not converting T4 to T3 properly? What if they have high conversion of T4 to reverse T3? What if they have thyroid antibodies, right? So the hormone replacement does not resolve all issues, right? So this is where we want to focus on natural solutions to a certain condition. So how do we use this, for example? This is very, very simplified example. So who I am, let's say I am a, let's say, nurse practitioner, right? Who do you help? I help women with thyroid and hormone imbalance. How do I help them? I offer them natural solutions to this, right? Hypothyroid problems. I offer them natural solutions to hormonal imbalance, right? I use integrative and natural solutions, right? I use primary care and natural solutions, right? You can use this and we can help you to modify and personalize it. But this is essentially the core of the way that we want you to communicate when you're sitting in front of a patient. Because if you just sit there and you say, the patient tells you about their pain points and you say, well, I'm offering functional medicine and it can probably help you a lot. That's great, but it doesn't really tell the patient who you are, who are you focusing on, what is your let's call it specialty or the what are you focusing on or what you see the most, right? And it doesn't tell them how you can help them, right? So we want to have a conversation in a language that the patient understands, right? And we want to do it without sounding salesy because we're not trying to sell anything. It's really all about educating them so they understand that what we're offering is very much different, right? We focus on natural solutions. We're focusing on health optimization. We're looking into what can we do to restore their health, right? And there's a lot of strategies we go into when we go into, for example, the primary script and the secrets of successful consultation, right? For example, a great question to ask your patient is, Miss Dana, I know that you're struggling with hypothyroidism. I know that one of your practitioners told you that it's because of old age and you're fatigued and because it's your genetic or whatever it is that they told her. Let me ask you this, right? Do you know other people in your community that are about your age but don't have arthritis and they don't have diabetes, right? So it's not just old age, right? Now let's talk about genetics. Genetics definitely play a role in it, but do you remember a time in your life when you didn't feel tired, you didn't have your hair falling off, you didn't have so much joint pain? Do you remember that time? Right? What we're trying to understand with using natural solutions here and functional medicine is really trying to understand what happened between that time when your body was healthy in your 30s, 40s, 50s to where you are right now. That's what it is, right? So when you're equipped with the primary scripts, then you are capable of essentially guiding the patient in navigating anything the patient tells you.
It makes the messaging really clear.
Yeah, absolutely. Do you take insurance? Oh, I got a script for that. Do you take, how much time would that take? I got a script for that, right? How is this different than taking pills? I already tried all those pills and all that. Oh, I got a script for that. I got a perfect script for that, right? Mm-hmm. How much would it cost me? I got a script for that too, right? So when you got scripts and you show up and you're prepared, right? You are going to be successful. That's why our community members, our graduates are successful, because when you follow the script, you can get. But what I want you to take from today is think about this simple formula: who you are, who you can help, how you help them. When you put it on your website, keep it simple. Who you are: I'm a nurse practitioner with 15 years experience. I'm passionate about helping people with thyroid and hormonal imbalance. I've seen so many patients over the years struggle and trying different medication. This is why I decided that I'm going to go beyond primary care and also offer natural solutions to their thyroid problems, and also offer functional medicine for their thyroid problems, right? I'm going to look at the root causes of their thyroid problem, right? So that's a formula that I want you to take today and start thinking of. And hopefully you got this written down, because we're going to move to the next step. Dr. Chill, I know you're diving much deeper when you're doing mentorship with.
Yeah, absolutely. Because it's really about personalizing it for the practitioner and what type of patients that they're seeing, right? But at the end of the day, it goes back to that simplicity, right? Who you are, who you're helping, and how you help. And that kind of laid it out perfectly in that aspect. And again, it's just all about making the messaging really clear for the patients, because when they're confused, they don't feel empowered and they don't feel trust. You can lose trust if you're not clear in your messaging.
Absolutely. And by the way, the way that we have built the Practice Accelerator, this is a really relatively brand new approach to doing this, right? We've taken years of experience between all my mentors who've taught me everything they know, and all the tries and errors and what worked, what didn't work for me and for Dr. Chill, and also all the successes that our community members have gained by working with Dr. Chill and myself as mentorship and guiding them throughout their growing their practice if they're at that phase, or starting when developing a successful practice. But we decided to do it differently, and this is where the new aspect come from, because we decided what we're going to do is not just do the mentoring, the one-on-one mentoring, but we want to do it together with you. So we've done it before, and it was a huge success. So that was about, I remember, 2 years ago, a year and a half or 2 years ago. So what we wanted to do is a program in which every week we meet with you on Monday evening, and we do it on Monday on purpose, because Monday is we want to get you the boost for the rest of the week, right? We want to give you that wind in your sail, in your boat sails, that will push you forward and tell you every week we'll take like one thing that we focus on and we'll build it together. So one week we might work on your primary script and how to to have successful consultations. One week we'll teach you how to do your signature talk. And then one week, for example, we're going to go on finding your clients, which is step number 6. Very, very important. Where do I find my, I'll say, ideal client? I don't want just any client, right? Yes, I want to help everybody. I want to help as much people as I can. But trust me, I learned the hard way from hiring and firing 4 or 5 marketing companies who would send me leads for the thousands of dollars that I spent, right? I learned that not every client is the right client, right? If your client shows up and they're not committed to themselves or their health, it's really hard to get meaningful changes. And I hope you're spending and investing your time in helping the right people, the people that will carry your guidance and transform their health, right? That's the people we want to work with. And of course, it's your practice. You do whatever you want to do, but I'm giving you, it's really hard and it's very frustrating to work with patients they're not ready, right?
And we're going to teach you how to kind of like vet potential clients, right? So they're your ideal clients. So you're not wasting their time, and they're not and you're not your time isn't being wasted. A lot of practitioners lose so much time by jumping on every single call with patients who are bad leads or not even potential clients, right? And so within the Practice Accelerator program, we're going to show you how to vet your ideal clients, from the initial lead, all the way to the booked call, all the way to scheduling them, right? And there's ways to do that. There's ways to vet them throughout the entire time. So you're only working and jumping on calls with your ideal client.
Absolutely. And again, I'm saying that as somebody who truly cares about other people and want to help as many people as possible. This is why we're here. We want to help you to develop your dream practice and increase your income by doing something that you're truly passionate about, right? Because you can get a job pretty much at anything, right? But we want you to earn money by doing something that you love, right? That is the most important thing. That's why we're here in this world, to leave a legacy and help other people in a meaningful way. So, like Dr. Chill said, we don't want to. I always tell my team when I train them, when you go into a consultation, you really want to figure out if they're the right person for you. And if they're not the right person for you, just let them go. We don't need that extra money if it's not going to be the right thing for them and for us, right? So, and I can tell you, there were instances. I'm not going to get into that too much now, but we had cases in our practice where a patient brought in a check for $5,600, right? She got some money from her saving account. She got some money from her retirement account that she had, and she brought me the check. Like, she put it on the table, and after doing a couple of consultations with her and her husband, I said, I don't think that we're a good fit for each other, and I sent her to somebody else's clinic, right? And you might think to yourself, well, $5,600, I can definitely use that to grow my practice and all of that. But it wouldn't be the right thing, because I felt, based on my communication with her, that she wouldn't be a right fit for me, and she was not ready to dive deeper into everything that we require her to do, which is, she might need to take some supplements or change her diet or change some things in her lifestyle. And so you never want to it's not about the money. It's really about getting the ideal client is somebody that you enjoy working with. You wake up in the morning, you're like, oh, I got these patients, they're here, they want to be here, right? So that's a big part. So how do we do that? There's 7 methods, but I think if you notice what I was saying, I already mentioned one of them, and that is that was something that I talked about here, which is your signature talk. So essentially, the easiest way and the most simple way without spending $1 in marketing is to meet your patients where they are, right? So there are many places, and I want you to think about, let's say if we're talking about chronic pain, right? So when I first started, I had no money for marketing. I paid my mentor $12,000 after 5 years of trying different things, reading all the books, going to conferences, right? Going to networking events, right? I tried that for several years. And then my mentor said, okay, who was your client? I said, chronic pain. I was in pain. I was able to get out of pain. They're in pain. Okay, where would you find them? Okay, you have any ideas? Let me know. Let me know in the chat. But I'll start, as I mentioned, I'll start downloading onto the board. So, support groups. A lot of patients are in support groups. Right? So what I did, I Googled chronic pain support group, right? I emailed the person that was in charge, and I found them, and I emailed them. It was in OHSU, and I went there, and I did this mini class, right? So I did this, what we call your signature talk to those people, right? Where else would you find people that are in chronic pain, right? Where else would you find them? Right? People with chronic pain. You can go to the library, right? The library, there's a lot of people and a lot of older people in the library. And guess what the older people suffer from? Pain, right? Degenerative conditions, arthritis, osteoarthritis, right? So I went to the library and I called them and I said, listen, I'm a practitioner. Again, this is why it's so important to get all of the steps right. I called the library and I said, I am this is my profession. I'm very passionate about helping people with chronic pain, right? Who do you help? How do you help them? I educate them and teach them about natural solutions to chronic pain. Can I come over 2 weeks from now or next week and do a 1 hour talk, right? 1 hour talk about natural solutions for chronic pain. They said yes. Of course, they said yes. These people are looking for somebody like you to show up, right? The library, big libraries in big cities actually have a person that is looking for somebody like you, right? They're looking for somebody like you because you're the person that is going to come in and bring more people into the library. So they actually help you to promote your event, which is really cool. Where else can you find more people? What about lunch and learn? Lunch and learn in small companies. They bring their lunch, you show up and talk about chronic pain, right? How do we offer natural solutions for chronic pain, right? What's another place you can do it? I even did this in schools, by the way. There's a wellness school. I called a few of the schools. I like, do you have a wellness day? Do you have a time when parents are gathering? Can I do this 1 hour talk? They said yes. I showed up, right? And then I also went to government agencies, Division of Human Services. Lots of social workers suffer from neck pain, back pain, hip pain, right? So every time I would go up to one of these, I would do the primary script and I would get another 1, 2, 3, or 5 patients to enroll in coming into the practice, right? So there's a lot more places you can find your patients, right? There's different ways you can promote your own event. If you just want to do it in your own, if you have a clinic and you don't want to do it in a clinic, right? That's fine too. By the way, where would you find people? Let me ask you this. If we're focusing on people with chronic pain, where would I find people, lots of people, thousands of people that are so health oriented that they paid 2 or 3 times more for the regular fruits and vegetables and grocery? Where would I find those? If you guess Whole Foods, natural groceries, you're absolutely right. I also went to Whole Foods. Whole Foods, many of those Whole Foods places have centers, have either a lecture room or some sort of a community room, right? So I went because that's my mission. Our mission is to help patients, right? So, and in case you ask yourself, what would I talk to them about for the 1 hour? Don't worry about it. We got you covered. We got the whole training with the PowerPoint to give it to you, and we'll give you the whole thing, right? But I want you to start thinking about, if I get 2 patients from here, I get 1 patient from here, I go to Whole Foods, I get another patient, I go to Lunch and Learn, I go 2 patients, or I just keep doing the library talk and get 1 patient, another 2 patients, another 1 patient, right? I keep doing support groups, right? So you can start. I filled up a practice just by doing this, right? I filled up my schedule just by doing this. I didn't even spend $1 on marketing at first. I just did that, and I just used the primary script. All right, we're gonna move on to number 7. If you got questions, hit us in the chat. I know that we're about. I want to make sure that I also give you the bonus one, which is the 7th one, and that is the follow-up. Dr. Chill, you want to mention to them how much important the follow-up is?
That's everything. It kind of goes back to the messaging and the communication, right? All of this is connected. And follow-up is going to be really, really important because you have to have multiple touch points with your potential clients when they're a client, and then to create that loyalty within that. And follow-up is a part of that entire system to really, really hone in on that comprehensive care and then get them to utilize the comprehensive care.
Absolutely. So I want you to think in a follow-up, I want to ask each one of you a simple question, right? Think about for a second about your the services that you're getting and you really enjoy, right? Let's say, think about your favorite restaurant, right? Favorite restaurant with your favorite dish, and you really enjoy time with your family or friends, and it was so much fun, right? And you went there maybe a month ago or 2 months ago, or whenever what that was, right? If they follow up with you, they call you and say, they call you and say Sabrina or Joanne or Gina or, whatever it is. How are you? Right? How are you? We have this, we have this really cool dish. We were thinking about you because we know that you like this dish, and we were thinking about you. And by the way, we have this really cool happy hour, right? Happy hour on Friday night or Saturday afternoon, where it's like, you get dessert on us, right? Would you go there more often? Would you spend your money in their business instead of looking at other restaurants, right? Most likely, right? Let me ask you another question. Your hairstylist or the guy that does your nails for you ladies, or whatever service it is that you can think of, if they would have actually called you and say, "Hey, how you doing? It's been a while since I've seen you. I wanted to ask how you doing, right? How are you? And by the way, I wanted to share this really cool hairstyle that I just did on one of their clients, and I took them from this to this. They look amazing now because of this amazing hairstyle that they did, right? Would you be more likely to show up, right? Or maybe they sent you a coupon and they say, "Hey, we got a new service. It's awesome. It's, this service is where we help you to take care of your skin from the inside out. So you're gonna be more vibrant. It's gonna look way better, right? Right? We have this special service right now. We're offering that, and we're giving this week a special offer on that, right? Would you be more likely to show up? Right? Of course you are, right? Now think about what we do with healthcare, right? How many of you went to a dentist or a primary care practitioner and you never heard from them again, right? You never heard from them. I can tell you pretty much almost every practitioner that I went to, I've never got an email, I've never got a call, right? I even took a family member. This is true story. I took a family member that was struggling with knee pain, right? Knee pain only after specific exercises, right? So this family member was trying to get back in shape. After every time they go to do a workout, whatever that is, in the gym or whatever it is, they would get this knee pain for several days. And they were trying to lose weight, and they started to feel better with exercising, but then every time they would get, they hit a wall. Like they exercise for a little bit, knee pain starts, they hit a wall, right? So I said, listen, it's very likely it could be mechanical, something that we got to look at your posture, mechanical, because it only happens after certain exercises, right? So I found this specialist, right? This is a doctor who specializes in orthopedics and sports medicine, and it was out of pocket, right? So we went there. I don't remember why it was out of pocket for that family member. Maybe they have really high deductible or something like that. But it was basically out of pocket. So this was like $350 or $400 for the visit. Now, my family member asked, "Hey, I feel more comfortable if you're there?" And I said, "Well, I mean, it's about 30 minutes. So I'll be there. No problem. Like, I'll be there." We went there. It was great. Like, it was really nice. It was a nice clinic. Not anything fancy, but we sat there. The practitioner kept eye contact, smiling, made us feel comfortable. I was a fly on the wall. I just said, I'm just here to support my family member. They did some examination. They watched them walk back and forth. They did whatever orthopedic specialist or sports specialist. They looked at how she exercises, like they gave her some exercises. And then in the end, he said, okay, here's what I found, right? And there are ways to address it. And I'll give you a couple of strategies now. And it was great. And they said, well, it's going to take some time to correct it, and we'll need to work on it, right? And then they escorted us to the reception. My family member paid. It was like $350 or $400, something like that. They paid. And then we said, thank you. And then we walked out the door, right? It was like a couple of months later, I asked my family member, so how are you doing? And they're like, the same. And I'm like, oh, I thought that we went to see that expert, that specialist. What happened? And she was like, well, I went to see there. They told me what was wrong, like with my alignment of my hip and my knee. And they gave me they gave me couple of recommendations, and that's it. I'm like, you never went back? Like, I thought they told you that it'll take some time. You need to work on it and correct it. And she's like, well, nobody called me, so I didn't make any appointment. I was like, I thought that I was done, right? So I was like, well, so anyway, I reached out to the office. So I was like, listen, I mean, how long do we need to come in? And they're like, oh, it typically it takes a few sessions and all that stuff with that specific method. And so I was like, how much money did they lose just on my family member? Just not reaching out to my family member. Like I asked her, and she was like, yeah, I would go. I would go at least 3 or 4 more times if they can, help me get relief. And I was like, 3 or 4 more times at $300 or $350 per session, they probably lost $1,000 to $1,500 just on a few more sessions my family member would have went to, just to feel better, be able to go back in shape and feel better and exercise regularly, right?
And you could do follow-ups really easily, right? Like you could do follow-ups there's could be an automation that occurs, that a text goes out. How are you doing? Click yes to talk with one of us, right? Or just shoot us a text back, or you do an email. Hey, how was that visit? How are you feeling today? Did the procedure work? Do we need to get you in for another visit, right? There's ways that you can automate all of these aspects, so you don't have to be the person that's constantly reaching out. And then we'll kind of go into that within the accelerator program as well, how to automate all of that for you.
Absolutely. One more step that I'll tell you with the Practice Accelerator is that we not only teach you the strategies each week and do it with you, like we customize it for you each week, but we also provide you with the software that does all of that for you, that has the landing pages and the automations and the follow-up and the communication and the SMS and the calls and the whole thing, right? And your primary script and your the 7 methods of getting new patients. So we're giving all of that to you, right, as part of the Practice Accelerator program. So you don't need additional tech. Like we provide you as part of it, a part of the program. We provide you everything you need to, build a successful practice.
Try to make it as easy as possible, because we know how difficult it is to start your practice, or if you already have your practice, to grow it, right?
Yeah, absolutely. Because when you think about it, that practice, and I'm giving again an example of that practice, they're good people. I can tell they're good people. They wanted to help my family member, and they were definitely, the doctor was definitely knowledgeable. Like I could tell, I don't specialize in sports medicine or orthopedics, but I can definitely tell the guy was super professional, very friendly, and very knowledgeable. And I'm like, I felt confident that he can help my family member, and she felt confident that he can help her, right? She would, when I asked her, she said, yeah, I would go there at least 3 or 4 more times, even though it was out of pocket, $350 a visit. So,
and all they needed to do was that follow-up.
yeah, I'm like, I just calculated out in my head as a person that have been in the business of healthcare for 20 years. I was like talking to her. I was like, gee, a simple phone call to ask how she's doing, and let's get you on the books so we can help you get better. A few emails, maybe a case studies, or sharing some more information about their methods or something simple, so simple, extra $1,500, right?
Exactly.
And not to talk about the opportunity to help another person who's suffering, who's struggling, and then not to talk about the I think my family member, if she would start getting results, she would probably stay there for at least, she would probably go there for several months, right?
Referrals. She would probably refer every family members, friends, all of that. Yep.
Absolutely. The referrals, like if she tells me, oh, this guy was awesome, I'm getting great results, I'm going to refer to him as well, right? So just think about that. There's loss of so much money on the table that they left, opportunity to help so many people in their community just by, and so, sometimes I'm thinking to myself, how many people like my family members are walking into that practice? They invest a lot of time and money and effort on marketing, right? And how many people walk in for one time and they never come back? Right. I'm like, that's like they're losing $20,000 to $100,000 easy every month just by not doing this one thing. So I want you to start thinking. We want you to start thinking about, how can I follow up after my clients? Now, you don't have to do it by yourself. There's a automation sequence with the software that we're using that we can provide you with a licensed CRM that is HIPAA compliant, that will help you to do all of that. And it's all onboarded for you. So you don't have to create the emails. You don't have to create the text messages. It's all automated, and it takes them straight. The follow-up, when it's automated, truly automated, it's not just you picking up the phone and saying, Mrs. Jones, how are you doing? It's like, it doesn't take your time. It's automated, and it takes them straight to the schedule. So it takes them straight into an appointment. Not only that, but a good follow-up also address all their objections or concerns. Objections, right? All their objections or all their concerns or all their frequently asked questions, like, how long would I need to come over to the practice? What do I need to, like, what do I need to in terms of my effort and time to invest? What would that look like, right? What's the benefit, right? So a good follow-up prepares the patient, right? And of course, when we go into the more advanced classes, we talk about how to do the follow-up before they even show up, which is a whole different game. But that's where you really get patients walking in and they're like, oh, I was looking forward to come here. I feel like you're the right person to help me, right? When they're already educated about you, right? So that's like a different level that we're going to go into, which is how to follow up before they show up to the first appointment, right? So that's a big part of it. That's a big part of the funnel, by the way. So this is the big funnel that we're going to be talking about next week. So let's see if there's any questions before we finish up for tonight. Was this helpful for you? Put it in the chat. What was helpful for you? What was the one thing that you took from today that is really, really beneficial for you to now start getting more patients in, to start putting together, right? Even if it's just in your mind, like putting together the practice of your dream, right? Because essentially what we're doing is, right, we're taking you from here to having the practice of your dreams, right? Now, the road might look something like this, right? For success, right? So this, it might look something like this, right? But we want to give you this system. So every time we install a strategy, every week we teach you a strategy. Every time we give you one of the tools, like the software that does all the follow-up for you, all the patient education for you. Every time we give you one of the coaching sessions and you apply something. Every time we meet every Monday evening, right? We do our Monday live classes, right? And we do a strategy with you. We help you to customize something. So every time we want to see you go up, 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 right? In terms of your income, in terms of the people that you help. That's really the goal with the Practice Accelerator. And then again, we give you all the systems. You don't need to create anything by yourself. So that's a big part of what we do here. So a couple of things that I wanted to mention and then answer a couple of questions for practice building or whatever it is. Today we talked about one model of care. Jacob, can you show the 4 models? Once we get down in the first month, first 5 or 6 sessions, we get down the cash services. That's the payment per service. Then we go up to programs. That's where you really scale up significantly. And you don't need a lot of patience when you use programs, when we apply the system of programs, because each patient will pay you $3,000 or $5,000 or $9,000. So you don't need a lot of patience. That's where you want more of like a boutique practice. You want to help focus the people that you really enjoy working with, that you know you can get great results. You don't need a lot of people to make a lot more money, right? That's where we get into programs. Membership is when you want recurrent revenue. So if you want your patients to offer them something more affordable and then have money coming in every month consistently, that's the membership. And then the educational self-care program, that is something that we go into. How do you take the information we teach you in the functional medicine and integrated medicine programs, and you put it out there for group sessions and self-care programs. So we have all of those advanced strategy that we teach. And then that's all, again, as I mentioned, with the program that we have, the Practice Accelerator. Jake, can you show the Practice Accelerator, practice program? So that's really all coming up with the Practice Accelerator. So we are going to essentially every week work with you together to build, a strong foundation for your practice so you can get more people in. And those classes are going to be a little bit different. They're going to be, we're going to be doing them in a way that we can actually see each other or we can communicate, because we really want to help each one of you and more personalize this. And then we also have the coaching call, like one-on-one. You're looking for a mentor like I was looking for, that can accelerate my success instead of me trying for 5 years trying different things, spending another 5 years or another 20 years trying different things. My mentor gave me like 1 or 2 strategies, and it accelerated my growth in like almost like 20 years, right? So you're paying for, essentially, when you're investing in programs like that, the return of investment that you want to get is that extra $3,000, $5,000, $10,000, $20,000 every month in return on your investment. That's really the only reason you want to grow your skills, is you can get better outcome for your patients. And the reason why you invest in business, mentorship, strategies, and systems is because you want to grow your revenue. You want to help more people or grow your revenue, or both. And it's okay to do that, right? So that's the program. We'll have more information about it coming out this week, how to enroll and where to get some of this information. We are going to, can you show the functional medicine, the bonuses? So a part of the functional medicine, we're going to, so if you are in the advanced and clinical functional medicine, functional nutrition certification program, then you're going to get access to some of these lectures at no additional cost, because we want to keep advancing your practice. We want to help you grow. So that's not going to cost you. You can join. We'll send you a link, and that link will have a special access code, and you'll be able to join those. Because again, as I mentioned, we are here really committed to grow, to help you to develop your skills. That the academy was developed by some of the same folks that established or teach at IFM or University of Western States and other places. It's just that we're here to teach you clinical application and help you to specialize in a way that you offer unique services that other people can't, and then offer functional integrated medicine and everything that included in between. And then we also want to help you grow your practice, right? So now that you have all these skills, clinical skills, and you can identify the person in front of you, what might be the 2 or 3 things that are driving the disease pathway, we want you now to know and understand how I can help more of those people, more of those struggling patients, and how I can earn more money while leaving time for myself, for self-care, for yourself, take care of your health, spend time with your family, doing the things that you love doing. So if you're getting certified somewhere else, you're studying functional medicine somewhere else, you can still join. We'll have some information how to join the Practice Accelerator. If you're in our community currently until the end of the month, because we're starting this next month, until the end of the month, we are going to give you the opportunity to join. And if you're already in our community, you're going to get access to some of those classes, because we want to help you, work with you, and help you grow your practice. So it won't be extra charge when you're already paying for the functional medicine advanced certification training. So for any of you that are in our program, I know that Dr. Badmus, for example, you're in our program. Then you paid for the clinical, the integrative, the functional medicine, and the certification. You're also going to get the Practice Accelerator program. So that's awesome. So so let's see if there's any questions. I think the last couple of questions that I saw was, if I'm a practitioner, I want to do virtual care with other states. So we actually have a 2-hour compliance class that was done by Dr. Stephanie, and she's a physician and also a healthcare lawyer specialized in healthcare. And she did a special 2-hour class on how you can do that when you're not licensed in a certain state. I'll give you the shorter version, and because we don't have 2 hours to go into the whole training on how to do that, I'm just going to put it out there as a disclaimer that we're not lawyers and you should consult a lawyer and all that stuff. But essentially, the way that our community members are doing that is by working not as a licensed practitioners, because they're not in other states. They're working as a functional health consultant, right? With that, you have to make sure that you have a strong disclaimer. The Academy has a really good template that Dr. Stephanie, who is also a lawyer, built for our community. So she built compliant forms and disclaimer forms for patients that you can use. We paid her thousands of dollars to do that for you. So you can go ahead and go into the practitioner toolbox in the last page of your platform, and then you will find those specific form. You want to have patients sign those, because they'll specifically say that you're either not licensed in that state, you're not offering primary care, you're offering functional health consultations, and they should maintain their relationship with their own primary care. What to do and then the last question, what to do if you are a nurse practitioner or a registered nurse and you have limited scope of practice in your state. We have lots of registered nurses. We also have nurse practitioners and sometimes PAs, lots of PAs and pharmacists, where they have to work under supervision of a physician. If you do primary care, get a supervising physician. If you're doing functional health consultations, in many cases, you can just use a disclaimer that says, I'm not doing primary care in my private consultation practice. I'm there to consult you. I'm not focusing on diagnosing or treating diseases. That's for primary care. I'm working on helping you to identify what's causing you sickness and educating you about strategies to improve your health. Simple as that, right? We focus on health optimization. We focus on strategies to remove the insulting factors, right? And coach and mentor those patients. That's exactly what so many of our registered nurses and PAs, like Zerla, which you can see her testimonial, built a successful online practice, and they charge $200 or $250. They don't do primary care. They don't diagnose and they don't treat diseases, right? They focus on educating root causes and focus on educating about strategies to improve the patient's health, right? That's a really good way to do that. Also, there's in my practice, we had physicians and nurse practitioners. We just decided that we don't want to do primary care. We don't want the liability. And just our philosophy is that if we can help the patient to resolve the underlying factors and use integrative tools, we can help them to improve their health. And we had amazing transformation. Anybody that is really trained well in the functional and integrative medicine have seen amazing transformation. Like we've seen patients, we had one patient, she gave us a video testimonial. She was in a wheelchair, terrible osteoarthritis of both of her knees, tried everything out there. Within 6 months, we found out what's driving the inflammation, right? Now, true, we cannot restore her meniscus and all of that, right? But we're able to reduce the swelling and pain to the point where she was able to go back walking again, right? She was able to sleep at night. She was able to significantly reduce her pain medication. She was so excited about it, right? You take her pain from like 10 out of 10 to like 2 out of 10, that's a whole different life we're talking about, right? So we had people that we helped them go into remission with autoimmune conditions. We have people that help them with cognitive function, hormonal imbalance. So you can do so much to help your patients, right? That's what we're here for. And I know, Dr. Chill, you've been coaching and mentoring our community members, and it's phenomenal. It's the best place to be, where we really focus about health and wellness, right?
And that's what it's all about, them getting better, right? And looking at the root causes so they can get better instead of just band-aiding symptoms. And that's why they're here for us. And that's why they're going to refer patients to you, is because you actually take the time to listen and then look and investigate everything that's going on and then address all of those issues.
Absolutely. That's what we're here to help them. And again, so if you take a few things from our conversation today, is focus on a niche, focus on your primary script. I did a mini class on primary script today. I give you a really good example. Focus on who it is that you're helping, how you're helping them. Don't throw in general terms, I'm doing functional medicine, right? Yeah, you can add it to the website. That's okay. Maybe add some SEO to it. But really, in reality, talk to patients in a language they understand, right? Natural solution to, or this. And then make sure to have a follow-up. Make sure that you are following up with you communicate properly. We talked a little bit about where do you find your clients, right? Ask yourself, once I know who I want to serve, where can I find them and how can I be there for them, right? So when they struggle, they can find me, right? And then, of course, as I mentioned, it's easier when you're not out there by yourself. It's easier when you have a community, and we meet together every Monday evening to help you to put every piece together with guidance and proven tactics and strategies to do this, right? That's really helpful. So I really want to thank all of you for being here. I know that you are going to help so many people, right? And I want to thank Dr. Chill for being here, for sharing his years of clinical experience and practice building experience. And
Thanks
you're
for
all
having
going to
me.
get a chance to work with Dr. Chill and our other mentors when you join the program. And I'm also going to lead you with these classes every week. We really do this. It takes a lot of effort. It takes a lot of energy. It takes a whole team to show up wherever you are at your house, in your computer. But we do that because we want to create a place in which we are there every Monday as an accountable partner to help you take the next step, right? When we show up on Monday, because we want to avoid the confusion of like, it's Monday or Tuesday, what do I do this week to grow my practice? What do I do this week to increase my income? We want to show up and give you the strategy and talk with you in a way that is engaging, in a way that personalizes things for you, and it gives you that push you need in the beginning of the week to create the life that you want for yourself and your family. So I really want to appreciate all of you. Thank you for being here. If you are not in our program, if you're one of our guests here, can you show the bonuses? So until the end of the month, if you enroll in our Advanced in Clinical Functional Medicine program, you'll get all the classes on clinical application. It's self-paced and 100% online. You get a phone app coming up with the treatment protocols. We're in the last testing, and then we're actually submitted it to the last update to the App Store. The phone app is really cool. You type in type 2 diabetes or arthritis, it pulls up all the strategies. It's got hundreds of chronic conditions and symptoms for adults and pediatrics. So you're going to become a knowledgeable functional and integrative medicine practitioner overnight just with that. We do include integrative nutritional herbal medicine. You get coaching mentorship. Now you're also getting access to the live practice building classes. That's amazing. So if you're interested, go ahead and put in an application, and we'd love to see you there. If you're getting certified or studying somewhere else, or you already got certified and you want to join, we'll release more information about the practice accelerator program, where we're working with you every week. So I really appreciate all of you for being here. And we'll continue to be in touch. We want to continuously help you grow your practice. And thank you for everything you're doing for your community. Thank you for everything you're doing for your patients, and for giving them hope where, we're being sort of the light in the end of the tunnel, right? Showing them the way and guiding them. So thank you again. I appreciate our media team as well, and Jacob, who's made it all possible for us to be here. And I hope you take care of yourself. Have a wonderful evening, and take care of yourself in the meantime.